Hi everyone. Good morning, afternoon, or evening, wherever you're joining us from. So I am Mapa Miller, and I started this group, gosh, back in 2020 when I had the worst sickle cell trait crisis of my life. And since then, it's just been trying to get other people with sickle cell trait to share their stories. Um, so yeah, and I'm really happy. This discussion is long awaited. Talking about sickle cell trait and two traits, beta thalassemia, with my special guest Chauncey, um, Chauncey Watson. So she's joined me all the way from Florida today, and we'll be discussing her story, sharing her experience. As many people know, I had a stroke after having the worst pain crisis of my life with sickle cell trait. Yes, it isn't benign, as many people may or may not know. Um, it's a lot of people don't understand it. A lot of people disbelieve us when we're in crisis, when we have sickle cell trait, and the diagnosis is there. It's been verified over and over again, but many times doctors and medics are still disbelieving us with sickle cell trait. Um, Chauncey's case is a little different because she's got two traits. So she'll get into her story. I just want to give her a bit of an introduction as well. So she lives in sunny Florida. Bear with me a second. She lives in sunny Florida. She is a librarian. She's a self-proclaimed nerd. Um, she loves reading, gaming, coloring, and crafts. I love crafts too. She lives with sickle cell trait and beta thalassemia, and she's going to share her lived experiences with a dual diagnosis of both traits. It is a special discussion because I wasn't quite sure, even though I touched on having a stroke myself, I wasn't quite sure how to approach the subject. It was just one of those things that, there's been ongoing symptoms still. And I guess as we go on into this conversation, we'll both be able to see the similarities of what we both experience, what we're still experiencing now. And without further ado, Chauncey, the floor's all yours. Welcome, and thank you for being with me today.
Sure. Hi. It's been a long time coming. We've been talking all week about this, and it's just been an experience comparing notes and experiences and everything. So I appreciate you wanting me to come on because I know I've been going through this largely by myself.
Mhm.
Um, so it's just been a learning curve, a steep learning curve.
Yeah.
So it's been about uh, 10 years, I think, since I had my first minor crisis.
Hmm.
And then my major one was in 2020.
Wow.
Um, so I guess I'll start with um, my mother discovered that I had sickle cell when I was about 6.
Hmm.
I reacted badly to some medicines or some vitamins, the Flintstones vitamins
Yeah.
as a kid. I don't know if you don't had those. I reacted badly to those. So they did some
Uh,
testing and that was it. It wasn't until I started having back issues that they tested some more and said, hey, you have beta thalassemia too. I
mm,
don't know what that means. So, okay. It was just kind of there.
yeah.
I've had, I was always an active kid, really. So when I started having back issues, that's when my mom became concerned. But
Hmm.
they just said, it's just growing pains.
Yep.
Okay. I don't
The
know what to do with
story that
that,
they tell
but
everyone, right?
mhm. Um, so in 2014, when I went off to college, I was playing sports, but I started getting shortness of breath
Mm,
and some minor chest pain. And I couldn't stand very long. So I was like, I don't understand what's going on. I've been playing sports for most of my life. I had to
hmm.
quit sports, unfortunately. Nobody could really tell me what's wrong. So I kind of just coasted the next 4 or 5 years
Hmm.
till 2016. I
Wow.
should have said that was 2010 rather, when I went started college.
Hmm. Yeah.
2016, I started having very bad leg pains,
Mhm.
and they took me to the ER. Um, and they said, "You have Guillain-Barré syndrome."
Wow.
Okay, that's very bad. It comes on quick. It
Mhm.
starts with the loss of your limb functions, and then it moves up. It's like filling up a cup. It
Mhm.
moves up to your nervous system, and once it gets there, it starts to shut down your organs.
Mhm.
But in my case, the pain, tingling, numbness, and everything didn't go past my hips.
Mhm.
So they said, okay, it's not that. We're going to send you to neurology.
Mhm.
They put me on steroids, but it wasn't lasting long.
Mhm.
No pain medication. They didn't do blood work. I was like, I need a second opinion.
Mhm.
This is something's not right here.
Mhm.
A million doctors later, I've seen in infectious diseases, uh, rheumatology,
Mhm.
um, psychiatry,
Mhm.
physiatry,
Mhm.
physical therapists, occupational therapists, you name it, I've probably done it,
Mhm.
until 2020, where I passed out. And that was largely because of a allergic reaction to albuterol, which is a asthma medication, because they said, you have asthma. No, I don't.
Wow.
I don't have asthma. I'm having chest pain issues. I've had several TIAs, trans ischemic attacks, which are mini strokes.
Mhm.
I've had several of those over the years up until that point.
Mhm.
Um, and that's how I ended up in the hospital a few times. They happen so quick that I can't even make it to the ER.
Mhm.
So I've learned to kind of just manage it when it comes. So that's a lot of rest. And that
Mhm.
means I actually have to sleep,
Mhm.
uh, and staying hydrated. I
Yeah.
learned I have to stay still. If I move too much, then it gets worse.
Mhm.
Um,
Wow.
so then when 2020 happened, they took me to the ER and I was in the midst of a pain crisis.
Mhm.
I didn't know that. To
Mhm.
that point, I hadn't thought that I could have one.
Mhm. Yeah,
Um,
because the research tells us that it's very rare to suffer
it's
symptoms.
rare that
Yeah.
we're asymptomatic. If we
Mhm.
do have any symptoms, they're minor. We don't
Mhm.
need to worry about it. Okay. But I was thinking, like, what about the people that are rare then? Like what
Yeah.
what happens? And then it was about that time that I actually found your group, Mape, and I was like, oh, so other people have this issue too?
Yep.
Um,
It was a
that's
shock, right?
interesting.
A shock.
Yeah, it was very much a shock because I've
Yeah.
been dealing with it up to that point for 5 years. And everyone kept telling me, it's not your sickle cell. It's not that. You don't even have anemia at this point.
Mhm.
Um, okay. Well,
Mhm.
what else is there?
Mhm.
Because everyone keeps telling me my blood work is fine, my
Mhm.
x-rays are fine, MRIs, CT, all sorts of things. It's got to be something else.
Mhm.
So when I ended up in the ER. My roommate was freaking out. He hadn't seen me that bad before, so he was like, "I'm gonna call an ambulance
Mhm.
and everything." So they kept asking me what was wrong. Now, by that point, the pain crisis was so bad that I actually lost speech because in the middle of that pain crisis, I also had a stroke.
Mhm.
And
Wow.
that rendered me paralyzed, like full. I could
From head
move
to
my
toe?
head,
Okay.
but and I could breathe,
Wow.
but as far as motor functions, there were none,
Mhm.
especially in my legs. I could not move my legs. I could barely feel my legs, and I couldn't talk. So I
Mhm.
had my phone. My roommate threw my phone in there with me, an
Mhm.
ambulance, and I'm typing, as fast as I can get my thumbs. they're asking me questions.
Mm-hmm.
I was like, I don't know. Sickle
Wow.
cell, maybe. I've albuterol, you know what I mean? Like to go through that, it was not only traumatic, but also nerve-wracking because I don't know what's going on and I don't have the ability to speak for myself to explain. And they're asking my roommate, and he's like, I'm not sure. She's never had this before. He doesn't know my medical history.
Mm-hmm.
We just had an agreement. I can't lift heavy things, take the trash out.
Yeah.
That was it. So to go through that um was just an experience in and of itself.
Mm-hmm.
So by the time I got to the hospital, they had a nice doctor who was asking me questions. He's like, all right, I'm typing, I'm answering his questions. He's like, we're gonna get you a room and we're gonna get you pain meds.
Mm-hmm.
Okay, great. It was a long wait, but they got me in there. This is where the trouble started, believe it or not. I got in there and I was approached by a doctor, and he's like, um, and they got me into a room, and they're approached by a doctor, and he's like, all right, you need to tell me what type of drugs you're on because this looks like withdrawal. And I can barely speak, and I'm freaking out. I'm like, as slow as I can say, I'm not on drugs.
Mm-hmm.
Don't know what you're talking about. I'm in pain here. You,
Mm-hmm.
you have to tell me what's wrong. I don't know what's going on. This is what's coming out. This is me verbatim.
Mm-hmm.
Uh, and he's like, you have to tell me. I can't help you unless you help me. And I'm like, you're not helping me.
Yeah.
And to
Making it
that point,
worse.
he got frustrated. I'm frustrated. I'm also in pain. I'm crying. I can barely talk.
Mm-hmm.
I've had a stroke. Like, dude, I need you to help me. So next thing I don't remember quite after that. It was a few days later. They tested me for later I found out that they really did test me for every kind of addictive drug under the sun. And
Oh
I
my
came back
gosh.
negative. Yeah. Didn't know they did that, but they did. Um, Another lady doctor came in. I think she was with hematology,
Mm-hmm.
and she said, yes, you're having a pain crisis. It's like, what the hell is that? I don't, what does that mean? And she's like, it's sickle cell. You have um, extreme pain with everything that you have going on and the stroke. And I'm like, okay, thanks for confirming that. But does that explain why I can't move, why I can't talk?
Mm-hmm.
Uh, like I'm not quite understanding everything.
Mm-hmm.
To this point, I'm by myself too.
Mm-hmm.
Um, my roommate wasn't able to come in yet. My brother wasn't able to come in yet, so
Mm-hmm.
I'm still having to use my phone, a piece of paper, and try to talk to these doctors. And okay, all right, so can I have drugs now because this is painful? And that was when I was
Yeah.
introduced to morphine. And
Oh.
thank God for morphine because it was there. So they got my pain
Yeah.
under control. And more doctors came in. They said I need to do various therapies. Great. The doctor who first asked me if I was on drugs was still like heading up my doctoral team. I didn't know that until he tried to send me home.
Mm-hmm.
Now, I lived on the second floor of an apartment.
Mm-hmm.
If I cannot move because I don't have motor functions, how in the hell am I supposed to get home?
Mm-hmm.
How am I supposed to be home once I get there?
Mm-hmm.
Like, are you understanding this, dude? Like,
Mm-hmm.
I cannot move my legs.
Yeah.
I have one working right arm to that point. I'm
Mm-hmm.
left-handed.
Mm-hmm.
I don't understand why you're sending me home. So I flat out told him, I said, look, I can't move my legs, so you're not sending me home. I need to
Mm-hmm.
go somewhere where I can be taken care of until I'm able to take care of myself.
Yeah.
And I said, I'm not moving my legs. I'm not leaving. And he was like, you don't have to take that tone with me. And I said, well, I'm not leaving.
Wow.
I don't want to be in the hospital. I'm not a masochist. I don't like pain. I don't want to be here. But how can you look at someone, you know they've had a stroke, you know
Mm-hmm.
they have sickle cell, but at this point they're anemic. They
Mm-hmm.
haven't given me fluids either, which I didn't know that I needed.
Oh.
They just gave me pain medication and several rounds of vitamins. Um, Vitamins and minerals
Mm-hmm.
that I was low on. And you're looking at me laid up in the bed and you're telling me you're gonna send me home. Look, sir, I'm not leaving. Now, to this point, I also made friends with the doctors. This is what you need to do when you're there.
And that
If
makes
you
sense.
can't advocate for yourself,
Mm-hmm.
with the doctor, advocate with yourself with the nurses because you're going to spend way more time with the nurses than you are with the doctor. The doctor is going to come in for 5 minutes, tell you there's a plan, here you go, and then they're going to leave on to the next person. But the
Mm-hmm.
nurses, they come in, they check your name, your birth date,
Mm-hmm.
what you're on, they give you your next round. You know, they spend a significant amount of time with you and they ask you questions. Are you
Yeah.
okay?
Yeah.
Even the food staff, okay, the food staff got to know me.
Yeah.
And by that point, I said, the nurse came in and I said, sir, I'm not leaving.
Mm-hmm.
You can you get another doctor to give a second opinion and to recommend that I go somewhere? Because look at me, I can't walk. You know this. You've changed my bedpan.
Mm-hmm.
My, you know, you've done this. You
Mm-hmm.
know I can't go home like this. I live on a second floor. How am I supposed to get up there?
Mm-hmm.
How am I supposed to bathe, eat, sleep? How am I supposed to do all that?
Mm-hmm.
So it was like 2 days, 3 days later, actually, that they got me in contact with another doctor, a second opinion, who was like, "Yeah, you can't go home like this. We're
Mm-hmm.
gonna send you to a rehab center." And then they got me in contact with a social worker who handled uh they handled everything from they picked the place that had the opening for me and
Mm-hmm.
transportation from the hospital to there. And then it was a matter of uh, quarantining because this is during COVID and making sure that I um, was in a safe enough environment.
Mm-hmm.
Um, so by that point, we had gotten contact with my mother. My
Mm-hmm.
brother and my roommate hated the doctor once they figured out what he was doing.
Mm-hmm.
Um, so they ended up speaking for me when he came in. And I did send a bad review to the hospital about that.
Mm-hmm.
Because just because somebody looks like they're in withdrawal doesn't mean they're in withdrawal. You don't know. You just walked in the room and met me.
Mm-hmm.
And that was not
Not
it.
even speaking to you properly.
Hmm. So that was January 2021. I spent most of January in the hospital, and then I spent February in rehab. And due to insurance issues, I ended up going home
Mm-hmm.
sooner than I could.
Wow.
Um, Now, for the last 3 years,
Mm-hmm.
I've had several TIAs.
Mm-hmm.
I was declared sickle cell anemic
Mm-hmm.
and beta thalassemia. They say I have beta thalassemia trait,
Mm-hmm.
which is not full-blown thalassemia, but because I have sickle cell trait,
Yeah.
they kind of
Makes
play off
sense.
of each other.
Yeah.
That's when I get the complications. So that's part of why I have the anemia, and that's also part of why I have the TIAs every now and then.
Mm-hmm.
So that means that I have to stay on top of the way that I'm feeling. So
Mm-hmm.
every day I have to categorize from head to toe how I'm feeling, how many spoons I have, as my therapist likes to say, count your spoons. You
Yeah.
wake up and my spoons are how much energy I have to do something. So if I
Mm-hmm.
wake up with like 10 spoons, it
Mm-hmm.
might take me 3 spoons just to get up and wash my face and brush my teeth.
Yeah.
And then I have to pace myself for the rest of the day.
Yeah.
Um, I did all the therapies, occupational, speech, and
Mm-hmm.
physical.
Mm-hmm.
Um, um, Speech was the hardest. I never thought I'd have to learn how to talk again. I had to learn how to eat again.
Mm-hmm.
All the things that, we take for granted. I had to learn how to do all of that again.
Yeah.
Uh, I ended up having to have eye surgery because I couldn't. Which way was the stroke? I forget which side, I forget how it works, but
Yeah.
one
Just
of
you know
my
that one
eyes,
side is paralyzed, right? And
mhm,
yeah.
and my eye muscles were kind of stuck. So I had eye surgery to fix it.
Wow.
Um, and then just the therapies, really. So I do my own physical therapy at home every day, even if it's just heel toes, I do them. Um, And then every now and then, if I have insurance, I'll ask, can I go to physical therapy? Because
Mm-hmm.
I feel like I'm getting stiff. My right side is my weakest side,
Yeah.
and it's getting weak again. And I don't know how to strengthen that with the exercises that I'm doing. And they do it differently depending on where you go.
Mm-hmm.
Um, and then I have nitroglycerin for when I do have strokes.
Mm-hmm.
Um, More recently, I found a great, great, great cardiologist who has some really nice staff. And they looked
Mm-hmm.
at my blood work and was like, you definitely have sickle cell.
Wow.
Right off the bat, I was like, all right, I'm keeping you guys because
Yeah.
he didn't even question it. He just looked at it, said, all right, that's what you got. And when the doctor came in, he's like, you got sickle cell and beta thalassemia. You got everything going on here. And I was like, yeah, you're telling me.
Mm-hmm.
So the chest pain and shortness of breath that I had, um, we tried to see if it was a heart issue that I had developed.
Mm-hmm.
I do have some vein issues
Mm-hmm.
in my heart, um, and some in my legs.
Mm-hmm.
Uh, but he's got me on an awesome medicine regimen that takes most of the pain away from that, which is great because that means I can actually talk to you for an hour.
Yeah. Yeah.
Before, I couldn't do that. Um, and we now know that it's just because of the sickle cell. There's literally nothing else wrong with me except I should probably lose, like 100 pounds, but that's another story.
Mm-hmm.
Um,
Yeah, I hear you. But when you're struggling with your mobility and your physical ability, then it's pretty difficult to lose that kind of weight as well. Even when, I mean, did you go through depression as well? Being at home, being so immobile, it's like life as you knew it before changed completely.
oh,
That's
definitely. When this first started back in 2016, I
hmm
was like, how in the world does this happen? I've been active.
hmm
I've ran track, soccer, bike riding, field hockey. I
wow.
even did some swimming, but I can't swim because I've got ear issues.
Mhm.
But I was like, to go from, and I used to walk to work too.
Mhm. Yeah, same.
I drove and suddenly I couldn't walk. Suddenly I couldn't drive. Like this was literally, quite literally overnight. So they always tell you, how to go through life and everything, but they never really tell you what to do when things go ass up.
Yeah.
If you're pardon the phrase. They don't tell you what to do when things go wrong. And all of a sudden you have to, figure all of that out. I had a job that I loved and I was scared I was going to get fired because I couldn't do it. It was a
Yeah.
physical job.
Wow.
Um, well, as physical as libraries go.
hmm
Um, but I had a commute that I had to do.
hmm
Suddenly I couldn't do the commute.
hmm
I was also in school. So to lose my mobility over a 48-hour period
hmm
was traumatic.
Yeah.
My therapist reminds me to give myself space and give myself grace because to go through that and then to also have no one believe you that something is wrong, when
Yeah.
you can't explain it,
Yeah.
is that's
It's
trauma
another
on
level.
top of trauma.
Yeah. It's another level
So
of trauma.
it's another level. And because of that, I think I even suffered some minor PTSD. I was
Yeah.
terrified to go to ERs and to go to doctors because I was like, no one's going to believe me. They're not going to test me for anything.
Hmm.
I'm just faking this pain.
Yeah.
In this country, being young, being female, being Black, it's not, I must be on something, or, I must have kids somewhere, or, be some type of, I don't want to use the word vagrant, but, you know, I, the stereotypes that have come about, I
Hmm.
must be one of those. I'm not a young, intelligent Black woman with a couple of master's degrees. Okay. No, that's not me. I'm just some sick person looking for drugs.
Hmm.
No, sir. I
Hmm.
don't like drugs. I don't like being on them. I react weird.
Hmm.
Um, so through the years, I have had several counselors,
Hmm.
several therapists
Hmm.
who have helped me to deal with the trauma of this
Hmm.
and to help me to understand how I can advocate for myself.
Hmm.
Um, and when I say advocate, I mean everyone has rights when it comes to your medical history. People
Hmm.
don't know that. When you go into an ER or when you go into a hospital, you
Hmm.
have the right to deny treatment from someone you don't like.
Yeah.
That's why they have second and third opinions. If you
Yeah.
don't agree with the first one, go to someone else. If you don't agree with them either, go to someone else. That's
Hmm.
why there's, millions of doctors in the same field.
Hmm.
Some are better than others,
Yeah. Yeah.
especially when it
100%.
comes to bedside manner, you know. Um, but I had rights as a person who's having a medical issue
Hmm.
to say that I'm having this medical issue and
Hmm.
I want to be treated like I'm having this medical issue. I don't want to be treated like I'm under the influence. I don't want to be treated like I'm having withdrawals. I don't want to be treated like a young Black girl who doesn't know what the hell she's doing.
Yeah.
No, you took the Hippocratic oath to treat people, no
You're right.
matter race, age, creed, whatever. You're
Yeah.
not doing that. You're not doing that. So I'm gonna go somewhere else and talk to somebody else.
Hmm.
Those are your rights.
Hmm.
Even if you don't have sickle cell, even if you don't have any type of health issue,
Hmm.
those are your rights as a person with a medical emergency, um, in a place that is built to deal with medical emergencies.
Yep.
So that's what I learned,
Hmm.
um, for myself and what my mom learned too, because she moved down from Florida, or she moved down from Virginia to take care of me because my brother was going into the military and I was living with his wife at the time. So she had nursing experience. So she helped take care of me until mom moved down.
Hmm.
So it was like, we have to kind of learn this. And she
Hmm.
had to too, because even to this day, I still think she didn't quite believe it. Like she knew it was there, but she didn't quite think. Everyone told her the same thing. She has
Yep.
sickle cell trait, she has thalassemia, but she should be fine.
Hmm.
No, Chauncey's not fine.
Hmm. Hmm.
Um,
Yeah.
so I have a counselor now who's a great help.
Hmm.
Um, because every time something happens, I have to kind of figure out a new way to
Yeah.
deal with the trauma. Um, and more recently, I had a pain crisis about 2 weeks ago. It was
Hmm.
a very minor one, but
Hmm.
pain crisis still hurt. Major, moderate, minor,
Definitely.
they still hurt.
Yep.
Um, and we went to a different hospital than the one that I normally go to because it was closer.
Hmm.
And they were like, okay, they did blood work, shows I have trait, but it didn't show that I have pain crisis. Um, but because I was in a lot of pain, the doctor could see that.
Yeah.
Um, they gave me Dilaudid, which I had never been on before, and I was high for like two
Heard of
days.
it. Wow.
The Dilaudid is about, what did they say, 6 or 7 times stronger than morphine.
Oh,
So they
wow.
literally only
I
gave me
need
like that.
some.
So yeah, I was floating. I was like, "Oh yeah, this is some good stuff." And then they tell me, then they gave me some medicine to take afterwards,
Mhm.
which was great. And they
Wow.
said, when you go to the ER, come back if your symptoms don't change or they get worse.
Hmm.
10 days later, I happened to be at my PCP's office.
Hmm.
She knows I have sickle cell, and she knows that that causes pain. So I was like, I'm going to keep her.
Hmm.
uh, but
They picked
she
up the
can't.
good ones.
Yeah, she can't. Since she's a nurse practitioner, she can't prescribe medication
Hmm.
outside of like ibuprofen or something, which
Oh,
doesn't do
really?
like good or anything.
I think I'm sure our advanced nurse practitioners in the UK can prescribe. I don't know the strength of what they can prescribe, but I'm sure they can. I'm sure they can. Over here anyway. So it's interesting to know the difference. It-
Yeah, I didn't know that difference because I had a nurse practitioner before her. I had to drop them because they didn't take my insurance. But I think she was under the umbrella of a doctor and he
Mhm.
could approve things. So I think that was the difference. She's not under a doctor, so she can only do so much, which is
Mhm.
fine.
Mhm.
Um, but the main fact is that she believed me, and I
Mhm.
was in enough pain. She actually asked me if I wanted to go to the hospital that day, and I was like, no, I'll
Yeah.
just be at home. I can just hydrate and get some rest. And she says, fine. But it just so happened that it got worse later that day. So we
Mhm.
went back to the ER,
Mhm.
and it was bad. It got worse.
Mhm.
And we had to wait this time. They were backed up. It was not fun.
Mhm.
Um, and when we finally got in there, they had me change, which was painful in and of itself.
Mhm.
They hooked me up to the machines. My blood pressure is all over the place. My heart rate's all over the place. You
Mhm.
can't really fake that unless you really
No.
know how to train your body, right?
Mhm.
Uh, and the doctor eventually came in and, he asked me what's going on. And I'm like, pain crisis.
Mhm.
This is pretty bad. And he's like, your blood work. This is literally what he said.
Mhm.
Your blood work shows you don't have pain crisis, so you're not going to get any narcotics from here. And then
Oh
he
my
walked out the
God.
room. I told my mom, I was like, I knew that was going to happen.
Mm.
I didn't even get a chance to be like, my pain crisis don't always show up.
Mhm.
That doesn't, just because it doesn't show up doesn't mean I'm not in pain.
Mhm.
So
Mhm.
like, I wish I had a chance to be like, with all due respect, sir, you don't know this body that I've been living in for 32 years.
Mhm.
I know it. This is pain, even if it's not a crisis.
Mhm.
You guys told me to come back if it got worse. It got worse,
And
but you're
crises
not going
don't
to treat.
always show up in the blood work as well, especially when it's traits. And I mean, I'd have to ask a doctor who specializes knowing, about sickle, because it's sickle beta thalassemia that you have, right? The
Mhm.
official diagnosis. But have they actually given you that name, the diagnosis of sickle beta thalassemia, even though they've said you've got the two traits? Have they actually classified it as a form of sickle cell disease?
No, so my
Oh.
hematologist,
Uh-huh.
um, he actually just he actually just separates them.
Okay.
He just says, I have sickle cell trait, beta thalassemia trait, and then he explains because I have the traits of both of them, my
Mm-hmm.
blood cells are kind of cut off, but they're not completely cut off. So
Mm-hmm.
that's why I don't have, the traditional sickle cell disease reactions, which is
Oh,
fine.
yeah.
But
Mm-hmm.
I don't feel like explaining that to ER people
Yeah.
every time I need to go. So I just say I have sickle cell anemia
Mm-hmm.
because most of the time I'm anemic.
Yeah.
Without it being too TMI, I
Mm-hmm.
have to actually be on birth control because if I'm not, I bleed too much. And
Yeah.
then
Wow.
um I get weak.
Yeah.
And by weak, I mean I already have enough fatigue to be losing that much blood over a
Mm-hmm.
short amount of time, you
Mm,
know, then they can be like, you might need a transfusion, which I've never had before.
yeah.
Uh, so I actually actively have to be on some type of birth control that either limits or takes away a period, because if
Mm-hmm.
not, then the sickle cell gets worse.
They
So
should be able to do like an ablation because I mean, I'm still waiting for that because similarly to you, I noticed, I mean, growing up, my periods were really, really, really bad, really painful. They'd trigger crisis for me. I'd have a pelvic bone crisis. But my periods were causing when I had the stroke symptoms, and I, like you, I had the one-sided weakness. I was paralyzed on one side. I
mhm.
It was really weird because the headaches that I was having was from March 2020. Then I had a major crisis. I didn't realize, um, like the headaches I was having started in March 2020. And then from June till September, I couldn't use my body. It wasn't my body anymore. I had
Yeah,
a crisis. And then I was telling them I'm having stroke symptoms. I'm going limp on one side, and it was just the one side, but then I would go limp over my whole body all of a sudden as well. And I was begging for a test. And my advanced nurse practitioner, because it's impossible to get a GP appointment over in the UK, they're getting worse and worse. Um,
mhm.
so the advanced nurse practitioner that I spoke to said, we don't really know that much about sickle cell and even worse about sickle cell trait. So, I don't think it's a stroke. And then December happened, and it was like, I've been telling you since the March that I'm having stroke symptoms. And then when it was visible, and I only realized, so it was a mild stroke, but it was still
It's still a
apparent.
stroke.
Yeah.
Hmm.
And it's taken me to this point to recover to the point, I mean, I'm still in recovery. I'm doing a lot better than I was with the stroke symptoms, but I'm still having to pace myself. Like you said, the headaches are almost daily for me. Do you get headaches that are like migraine-like, but not quite migraines with no, yeah.
Sometimes,
Hmm.
I only get them. I used to only get them when it's time for my period, but
Hmm.
since I don't have one now with
Yeah.
the birth control that I'm on, I get them when I don't drink enough.
Okay.
So I actually have to make sure that I do drink enough. So I think I
Yeah.
drink, this is like a 28 ounce sippy cup. I think I fill that joint like maybe 4 or 5 times a day.
Okay.
I
Yeah.
drink a lot of water.
Mine is, I don't know how many ounces, I can't tell, but I know it's 2 point something liters. I don't know if you can see it properly. Yeah. It's got
Hmm.
herbal tea bags in that are cold infusions. For today, I just feel like it. But yeah, I drink at least two of those a day. And sometimes when I start having like the headaches and pre-crisis, I call it a pre-crisis because you kind of get those signs. Well, for me, majority of the times, I know like my body's it's telling me, you're gonna have a
Yeah.
crisis, slow down,
Hmm.
hydrate, and the headaches come on, and it's like, okay, I'm really thirsty. I can't quench, no matter how much I drink, I
How
can't.
much you drink? Yeah.
Yeah, you can't quench the thirst. It's crazy. But yeah.
Hmm.
What I wanted to ask you was, I don't need to know the name of the pills, but see if they can offer you something as an alternative because I was looking into birth control, and for sickle cell, it can be dangerous, especially because if you've had a stroke already, it can bring on symptoms. You probably know that, right? I kind
Yeah.
of I was scared of that, and I was like, okay, because of this, I don't want to go through that again. Um, and I just had to stop taking them. But then, thank God, since my body's literally just gone upside down, where I'm experiencing months where I'm not bleeding now. And I don't know if that's because of the medication that they've given me, because it seems to have stopped with the medication that they gave me after almost 2 years of having these bleeds that would last months, and to the point where I was wearing, I think there's a video or a picture on Facebook where I actually put a photo of these huge, like, I don't know if you have Tenor Lady in the US, but Tenor Lady like pads that are like adult size diapers. And they're really crazy, but that's literally, I think with sickle cell trait, there's never t TMI. I think the more people know, the better, because I mean it's humiliated me enough anyway as it is. So,
Mm,
you know,
mhm.
and then
Yeah.
so yeah, I feel like, see if they can give you something else that's not gonna be another pill that can potentially cause you more damage, more harm, because it's scary. It's scary.
Well, yeah, when I went to the cardiologist, I
Mm,
told them, my medication regime, they got me off the steroids
mhm,
and a nerve blocker,
mhm.
uh, because they weren't doing anything. And I knew they weren't, so I stopped taking them. I had to wane
Yeah,
off the steroid though. But they were like, you need to get off that birth control.
yeah.
Because it's not helping your stroke symptoms.
Hmm.
Uh, so then I changed to an implant. So I have an implant now.
Okay.
And excuse me, and I spoke with my gynecologist, and I
Hmm.
told her too, hey, I have sickle cell and I
Hmm.
have a tendency to have TIAs. And
Hmm.
my cardiologist said that I can't take this anymore. So what are my other options?
Hmm.
Now, the thing with birth control is you probably like there was like maybe half a dozen of them that were
Hmm.
on the list. Probably four of them,
Wow.
they actually say they cause strokes.
Wow.
Two of them were implants. Um, and I wasn't comfortable getting an IUD.
Hmm.
Uh,
Me too.
I was like, no, I don't want to do that. Do I
Yeah.
have another option? Because I literally couldn't take the other ones. Like my gyno was like, no, you can't take those. So I
Hmm.
ended up with a different kind of implant that's in my arm.
Hmm.
So I don't have to take anything. It's good for 3 to 5 years.
That's good.
And I haven't had a period since. It's been like three months now.
Hmm.
So it's like
That's
a
good.
beautiful thing because I had to get over the embarrassment of you know, being paralyzed when you can't, take care of your uh uh
Your hygiene
bowels,
needs.
your
Yeah.
hygiene,
Yeah. Yeah.
and when you have a period, that us
Yeah.
women, we know periods are messy,
Yes.
okay? It's messy.
Oh my
But when you
gosh.
can't do that for you, I had to get over that when I was in the hospitals. They're gonna have to clean me, wash me,
Yep.
do all that stuff.
Yep.
And then when I went to
100%.
rehab, they said, as you get better, use the adult diapers. And I was like, seriously?
Mm.
Okay, so I had to get over that. And then I discovered different brands and I was like, ooh, these are kind of comfortable. So before I switched birth controls, I bought the ones that, were comfy.
Uh-huh.
Uh, and it made me feel less embarrassed,
Yeah. Yeah.
and more comfortable. And it actually helped my mom out too, because we could just like, in an emergency, she can just like cut it off
Yes.
or
Yeah.
tear it off. Some of them you can tear off.
Yeah.
Um,
Yeah.
and it's like easy cleanup, back to
Yeah.
baby, you just tear it off, use some
Yeah.
wipes, toss it, and there you go, right?
Yeah. Yeah.
Um,
It's
so
crazy the things we've had to deal with, man.
right. So when it comes to, that part of sickle cell too,
Mm,
when you have the sickle cell, when you have the pain on top of the stroke symptoms, and uh when they don't dissipate. So, like in your case, when it's months and
mm,
it's there,
mhm,
it's happening,
mhm.
and you're trying to get help, that's a whole situation in of itself. For
Yeah.
me, it was a bit different in that mine would last a few days.
Mhm.
Um, but if it's compounded by a pain crisis, then
Yeah.
suddenly I'm back to paralyzed.
Yeah.
So I
100%.
can revert at any time. which is something that's always in the back of my brain. So like I'm fine now.
Mm-hmm.
My speech is probably like 90% back to normal.
Mm-hmm.
Um, I have to change my diet a bit. So
Yeah.
I limit dairy, gluten, nightshade vegetables. So that's like peppers and potatoes.
Mm-hmm.
Uh, and I eat more vegetables, more fiber, try to
Yes.
keep my colon and intestines kind of clean.
Yeah.
Which I learned helps with swelling.
Yes.
The arthritis that I have,
Mm-hmm.
um, you kind of learn that stuff by trial and error.
Mm-hmm.
And then
100%.
you can, when you start to kind of feel that, when you feel better that way, then you're better able to identify things that trigger pain and
Mm-hmm.
swelling. And
Mm-hmm.
you're also better able to identify, as you say, pre-crisis symptoms.
Yeah. Yeah.
So I know when I'm having a TIA.
Mm-hmm.
I know when
Okay.
it's coming on. I can't tell you how long it'll last, but most of the time it doesn't last more than 3 days if it does happen.
Mm-hmm.
Um, I also know when I'm having a pain crisis because my it feels like I always say it feels like if you've ever seen a TV that doesn't get any signal and it goes like black and
Mm.
white and it's
Yeah.
all that's what
Fuzzy.
it feels fuzzy.
That
Yeah,
fuzzy
that's what it
feeling.
feels like.
Yeah, yeah.
I don't know
Do
if
you
that even
tingle as
makes
well? Do you get like
it
the tingling?
yeah,
Yeah,
the tingling.
yeah, yeah,
It's there and then I get the joint pain is just ugh, I've never felt anything like that.
yeah.
And I really wouldn't wish it on my worst enemy because when it literally hurts to move even your fingers,
To touch
you
your
know,
skin.
in your skin, and it just,
Mm,
it's a whole body thing because you have blood in your veins. It's everywhere.
everywhere.
You cannot get away from it,
Yeah.
right?
You,
It's not just a
sorry, go on.
thing.
Mm-hmm.
It's not just like in one spot.
Yeah,
Like
yeah,
people can have certain conditions.
yeah,
If you get into a car accident, you break your leg, then the pain is just in the leg. You
yeah.
know,
This is
it's not
everywhere.
it's not just that. So people think it's you know, it's just in one side. No, it's everywhere because we have blood everywhere. It
Yeah,
circulates. Some parts might be worse pain than others,
yeah.
but
It's everywhere.
it's
So when you're
everywhere.
in pain, it's like I mean, and then there's the chronic pain as well that you're continuously left with, because
Mm,
that's another issue of itself, because that gets worse when you're in crisis. It just seems to just flare up even worse and it's magnified. But then the pain crisis, I mean, I find that if I have a crisis, sometimes I'll have a crisis and it's just in one side or in my arm or in my leg. Um,
mm,
and sometimes in my head, although thank God, since I can't remember if it was last year sometime, I had a another stroke like symptom where my face just paralyzed and I felt the tingling. All I was doing, I hadn't stood for that long in years, and I decided to do my niece's hair. She asked me to do her hair, to braid it for her, and I said to her, okay. So I did her hair. I said, I'm gonna pace myself. It's gonna take 3 days. She was on school holidays. So I did her hair and I decided to do it. And even though my hand is okay now, I can actually do a fist, but I can't clench tight. It doesn't work to actually clench tight. And my thumb and my first finger are I can't actually, I realized a few months ago tying laces on shoes, it's really difficult to actually pull my shoes up. I don't have that simple grip facility, so I had to buy a shoe horn that's really wide to just pull, like Converse, the back of my Converse, I couldn't grip it to pull up. And I said to my mom,
mm,
I can't even do the basics for myself. I said, that's really difficult. I've improved, but there's still, that still remained.
mm.
But yeah, back to doing my niece's hair. I started doing her hair, and all of a sudden my hand locked and it started swelling, the throbbing in my hand. I was like, I think I'm doing too much. And all I was doing was just braiding hair. And I continued, I pushed through, which I knew I shouldn't have done, and I was in agony for it felt like flu symptoms. That's the only way. If anyone's had like a mild case of flu, it kind of felt like mild, but in my case, it's quite severe. It gets really bad and it escalates quickly. Um, and it took me, I think, 2 weeks to recover from that. But after doing her hair, after I finished her hair, I was down. I started having the tingling in my fingers, in my arm, and then my face just went, and it went at the same time. I felt like the left side of my face paralyzed, and then the right side went. And I was like, uh-oh, what have I done? So now I know if I'm gonna end up pushing myself to that point, not to do it. And then but so what are like the symptoms that you get before a pain crisis? Do they are they because I know we spoke about like the headaches with the TIAs as well, the tingling and the headaches. And what are are there any similarities between the two that you get, or what is it that that's prominent, that stands out to you the most when you're having like a TIA that you notice, or just before the pre-TIA? I can't quite tell fully.
Um, well, this goes back to the chronic pain that you mentioned.
Hmm.
So I have um I have pain in my legs all the time.
Yeah.
Um, Especially in my feet. Sometimes
Hmm.
they go numb, so I can't really feel things, which is why I don't drive anymore.
Hmm.
Um, it's just there. Some
Yeah.
days it's easier, some days it's better, some days
Hmm.
it's worse. I don't
Yeah.
really understand the frequency of it. I do know when I can't push myself or when I
Mm.
can't, go with mom to the grocery store and walk
Hmm.
around. I
Yes.
can't go to Walmart today, Mom. Can we like not do that?
Hmm.
Or we'll go to Walmart, but we won't go to the other three stores we were thinking about going to that day.
Hmm.
Um, so it's kind of just there.
Hmm.
That's where the worst of my pain is. When I have my when I have a TIA,
Hmm.
it usually starts off with some type of headache, and
Hmm.
I don't, it's not like a migraine, it's not like a tension headache. It's it's just a headache. It just like my head just hurts.
Yeah.
Now I'm sensitive to light. My breathing starts to get worse. My chest starts to hurt.
Hmm.
And depending on that pain,
Hmm.
um, I don't know how to describe it. It's kind of like a throbbing pain a little bit.
Yeah. Yeah.
If it doesn't go away after a certain amount of time, that's when I know I need to take some nitroglycerin.
Hmm.
Um, when it comes to the pain crisis, I don't actually get headaches. It
Hmm.
just the pain in my legs gets worse
Hmm.
and it stays that way.
Hmm.
So it's different from the chronic pain in that, some days are easier than others.
Yeah.
It's like somebody turns up a dial
Yeah.
and it's just there. It's not going away. So
Hmm.
it's different from the chronic pain. And
Hmm.
then the tingling and numbness, which I do get with the chest pain, comes, it's like somebody turns up the dial again.
Hmm.
And for me, it starts in my right side. Uh, my arm and my leg
Hmm.
will go first. So,
Hmm.
like you were saying, like when you have a phone and you're texting, like my
Hmm.
thumbs, sometimes I can't actually move my thumbs.
I get that.
They kind of just get stuck in like that position.
Wow, I thought it was just me. You're the first person I've heard say something like that, because I get that, and I'm like, I can't use my thumbs. Literally, I'm texting, and it does happen when I'm texting. I'm texting, and it's like I can't actually move my
Move
fingers. They
my
get
thumb.
stuck. Yeah, both my thumbs. And sometimes some of my fingers, I'm doing something and I can't do something. And I never used to experience like joints, my finger joints. I never used to experience my finger joints hurting that bad. It would be my skin and my whole hand, my arm would swell.
Yeah.
And that was always, I'd get fevers and the swelling of my stomach. And that still happens where my stomach, my ribs hurt to the point of touching my skin, it hurts. Um,
Hmm.
but yeah, it's crazy, the similarities and the things that I think echoed within the whole community, with sickle cell anemia and sickle cell trait, and now having, sickle beta thalassemia as well. The similarities are, they're undeniable, I think, especially once they've ruled everything else out, and still we get those medics that are like, nope, it's not it. But you're like, it's tiring going backwards and forwards with them and having to keep trying to make someone believe you. So now I'm like, whatever, I don't really, I kind of was dwelling and remembering what you said about the trauma, because yeah, that level of trauma, man, it's something else. It's
Something else. Hmm.
Yeah, that's mainly been one of the reasons why I've been so quiet, because the trauma, I had to deal with that, but I had to also deal with my own health because I was kind of trying to do so much. And mentally, last year, I was in a place where I think I was trying to ignore the fact that I'd just been through something so major, even though it was 2020. So, already 4 years ago. But at the same time, um, it was still so fresh, so raw, and I'd be discovering new things that I was struggling with. Thankfully, finally, I got given home help aids where I don't immerse myself in the bath because I can't grip the sides of the bath to get out. So I use a bath board to
Hmm.
sit on the top, and I use a jug. I'll use my flannel, my washcloth. Scrub myself. Use a jug to kind of wash. Um, and that's how I do things. And then I have a perching stool in the kitchen. So when I'm doing my, because I know that that's one of the triggers. If I stand too long, it can either trigger a crisis or it can trigger those headaches as well. And again, for me, the headaches, like you were saying, the headaches are symbols of, and then the tingling. I've had that recently where I stood for a while and the tingling came on and I was like, I don't want another stroke, because I started feeling pain in my face. Um, and I thought, just kind of chill. Just take it easy.
Yeah.
Just try and put your feet up. And I have to tell my family, right, I'm gonna go and sit or sleep, or I just don't ask me anything. Please don't ask me anything.
Yeah. Don't bother me.
Yeah.
All right now. I
Yeah.
can't handle it. I
Yeah.
just need to be by myself. I used to tell my ex-boyfriend that he would come, and
Hmm.
sometimes I'd be having a bad day and I'm like, don't come over because I'm not going to be very much company. And he's
Yeah.
like, oh, it's fine, I'll come over. And they touch me and I'll be like, all right,
Yeah.
let's,
Leave
because
me
you touched
alone.
me, I told you not to. It hurts.
Yeah.
My skin hurts. I don't even want to wear clothes. Like,
Yes.
I
It
can't be
hurts to put
bothered.
them on, right?
Hmm.
Yeah.
Like,
Yeah.
to not be TMI, like my mom, she's always like, why are you walking around and you don't have any clothes on? And I'm like, because it takes work. Not only does it take work to get dressed, it takes work to have the clothes on, because
Yeah.
sometimes my skin hurts and it's not always in the same place. Sometimes it'll
Hmm.
just be my legs, sometimes it'll
Hmm.
be my arms,
Hmm.
and and I'm like, I can't be bothered. So I have like this blanket. I
Hmm.
don't know, what do they call this? Like fleece.
I can't see it. Oh yeah, yeah, yeah. Fleecy blanket. Yeah.
Yeah, the really super soft,
Uh-huh.
stuff. That's kind of what, because it doesn't scratch my skin.
Yeah.
That's what I'll have covered myself with, because I can't be bothered with cotton or polyester or whatever
Yeah.
else to clothes with, because then my skin is just like, I don't know who told you to touch me with that, but I'm gonna need you to stop, right?
Yeah. Yeah.
So
Definitely.
like the sickle cell, it comes with so many different things.
Mm.
When you look up sickle cell disease, most of the time they just talk to you about transfusions and
Yeah.
the weakness, and they say, most people, they have they are able to live regular lives. They just have, certain symptoms that require transfusions. They have to stay warm and hydrated,
Yeah.
and avoid certain forms of travel, but they don't tell you about the little things that come with day-to-day life.
Mm,
So, like you were saying, sometimes I can't put on my shoes and socks.
mhm, mhm,
So my brother brought me some really awesome Crocs. I literally wear them every day because I just slip my feet right in and
mm.
I'm good to go. My mother bought me some slip-on shoes. Um, so I don't need to do anything.
Yeah.
Just put my foot right in it and the
Uh-huh.
heel just kind of pops back up. I've been wanting those forever. Ever
Nice.
since I saw Snoop Dogg wearing them on a commercial. But they come in handy because I don't have to bend to put the shoe on.
Yeah.
I just slip my foot in it.
Mm-hmm.
It's like little things like that that make
Mm-hmm.
it easier to do certain things.
Yeah.
Um,
Yeah.
because if not, I don't have the spoons to do it, so I'm not going to do it. It
Yeah.
hurts. It either hurts because of the chronic pain, or
Mm-hmm.
I'm just too exhausted to do it.
Yeah.
So then I have to wait. So like we moved into this house about a year or two ago, and
Mm-hmm.
there's a walk-in shower.
Oh,
So we put a
nice.
shower chair in there, and it has
Uh-huh.
like a removable shower head.
Yeah.
Um,
I'm dreaming of one of those. I miss having a shower.
yeah, the old house we lived in, it was
Uh-huh.
we had to take the doors off
Mm-hmm.
because it was a walk-in shower, but it was like glass doors. So I
Okay.
wasn't able to get in there.
Mm-hmm.
So we took the doors off. So it was just an open space, and then we hung like a curtain.
Mm-hmm.
And and then we went to Walmart and bought uh the removable shower head because it
Oh,
didn't have
yeah.
whoops, it didn't have one.
Mm-hmm.
And that way I could just, bathe myself because
Yeah.
I couldn't to that point. I didn't have that. I had a tub at
Yeah.
my old
Yeah.
apartment and I couldn't get in and out of the tub, and there was no way I was soaking myself because I couldn't grip to get out or get up.
Yes.
That was
Yeah.
just not happening.
Yeah.
I
It's
had home
dangerous.
health. hmm I had
Mm-hmm.
home health aid um, there, and then when we moved into the new house, I had home health aid too. And
Mm-hmm.
sometimes they would help me shower because most of the time my mom would do it. And still to this day, I tell her I'm going to shower
Yeah.
because sometimes I get dizzy and then I get the headache and then I
Yeah.
pass out and I fall in the shower. And
Yeah.
that's not fun. I've done
No,
that a
it's
few times.
scary. It's
It's
dangerous.
scary, it's painful, and then she has to pick me up because I can't live in the shower now.
Yeah.
I can't do that. Um, but like when you deal with the trauma of first having a crisis
Mm-hmm.
and then having your mobility taken from you or whatever it is from you,
Mm-hmm.
and then you have to go on to, the doctors who don't believe you, or if they
Yeah.
do, they're not sure how to help you because they know next to nothing about it. Um,
Yes.
you have to go through that, and then you have to go back home and figure out how the hell you're going to live a daily life
Yeah.
because
What adjustments can you make to help yourself because they're not doing it?
they're right.
Yeah.
You are the one that have to live with the body that you're in. So
Mm-hmm.
you have to learn it and you
Mm-hmm.
have to make the adjustments, you have to adapt and you have to learn these things. So
Yeah.
not only do you have to advocate for yourself
Mm-hmm.
outside of your home in the
Mm-hmm.
medical field, you have to advocate for yourself
Yeah. Yeah.
because
Definitely.
you have to do these things. And if you're working or looking for work, then you have to make sure that that work is appropriate for you. And that's been something I struggle with. I haven't worked in 4 years. I'm
Same.
hoping that I land this job that I'm getting
Mm-hmm.
interviews for. It's another library job. It's on site, which is not ideal for me,
Mm-hmm.
but um, I have ways that can be accommodated,
Mm-hmm.
right?
Mm-hmm.
Um, and so that was something new that I had to also look into. I couldn't
Mm-hmm.
do the old job I was doing because I couldn't talk for this long. It was a
Yeah.
cost of the job. I
Yeah.
can't talk for 8 hours a day.
No. Yeah.
I
Yeah.
can't. I can barely breathe for that long. Like
Mm-hmm.
we're talking now, I'm gonna take a break
Yes.
after this
Yeah.
and play with my
Yeah.
niece
Yeah.
because she doesn't need me to talk to her.
Yeah.
She doesn't care. She just needs toys.
Yeah.
Um, so I have to make sure that I'm okay when I wake up.
Mm-hmm.
Um, what am I going to do today? Am I going to have enough spoons to brush my teeth? Am I
Yeah.
going to have
Yeah.
enough to wash my face, put
Yep.
on clothes and socks? Like I have to do it in stages
Which is, yep.
and make sure that, all right, I can do these things.
Mm-hmm.
But then what else do I need to do today? Am I going to go for a walk?
Yeah.
Um, am I going to cook dinner today?
Mm-hmm.
'Cause my mother cooks most of the time,
Yeah.
but I make the smoothies. She doesn't, she likes the way I make my smoothies.
Yeah. My
So
mom.
I have to, how long do I have to stand at the counter to do that?
Yeah. Okay.
So
Yeah. Yeah.
those things you have to think about and you have to advocate for yourself. Give yourself that grace and that space. Like my therapist always tells me
Yeah.
to say, hey, I can't do this today. Let's save this for another time where
Definitely.
we can do this today, and that's
Mm-hmm.
okay.
Mm-hmm.
Um, and that's part of the daily life with
Yeah.
symptomatic sickle cell anemia, sickle cell trait, beta
Mm-hmm.
thalassemia for me. So that's kind of what I've been, how life's been like for me for the past 4 years.
Yeah. So much similarities. I mean, it's amazing to kind of find this community because like when I initially did that post where I was like, okay, guys, if you don't hear from me, and I was literally typing with one finger because I couldn't use my phone. So it was next to me and I was just one finger typing. It took every ounce of strength that I had because I was in full-blown crisis head to toe. And I was just, I can't respond. But does anyone else have a sickle cell trait crisis? I have crisis and I have sickle cell trait. And then when I got a response and responses from family members, friends that I knew that, they'd either experienced mild bone stabbing pains and they didn't know what they were down to. They never realized that they were suffering a crisis and they never had anything else wrong with them. Everything else was ruled out. And they were like, okay, I think it's a crisis that I'm having. They were asking me, what kind of pains do you get? And I would have to do voice notes, but again, pacing myself. Um,
Mhm.
and it was just mind blowing that so many people were going through a similar thing or the same thing, and yet they'd been dismissed or been told that they can't suffer. So they never checked it out or looked into it until something went wrong. And that seems to be the common the common theme that I'm hearing is like something has to be a major, major thing. Like having a stroke is it's not a tiny thing. It's even if it's a mild stroke, it's still a major life
It's,
altering event,
mhm.
and it changes the way that you do things. And like you said, dressing, I mean, I'm not as tired as I used to be with dressing, but I'm still, it's still a challenge. And some days are different. Some days I have a bit more energy. Other days I have to really just do nothing because I feel when I'm tired, I shake, my whole body trembles
Yeah,
inside.
I shake too.
Yeah, it's horrible. And it's like when someone says, oh, I'm tired, and it's like, no, I'm really tired. But when you just don't say anything because you're like, I'm really, really exhausted, but I don't want to keep singing the same hymn sheet. So I'm trying to change my mindset, change the way that I think about, okay, how can I enjoy life now? How can I do things that will benefit me, but also help my family? Because my mom hasn't been very well for a long time. And so she manages me when I'm unwell, but then sometimes it really affects her and her blood pressure. And she's elderly now. She's, in her 70s, mid 70s, and she's a strong woman. I mean, big up your mom as well, for looking after you, and my mom too, and all the moms out there that, have children that have gone through either sickle cell trait crises or sickle cell anemia crises, because pain crises in any form, like you said, I wouldn't wish it on my worst enemy. And going through a stroke as well, and having to alter the way you think, the way you do things. Um,
Mhm.
I found I was slower. I mean, you said about driving. I've started learning to drive and I was on the verge of giving up because I started last September. Um, and I was thinking, do I give up? Because I wasn't grasping it in my head. I was thinking, okay, I can do this, but then putting things into practice was really difficult and really like I wasn't grasping it. It was taking too long, and I would have 2 lessons a week. And even that was a lot. My mind, I'd have headaches afterwards because even just concentrating for 2 hours now, a few years ago, even an hour after the conversation that we have, I'll still have to rest, but it was worse back then. I would get so confused. I wasn't able to figure out Facebook Live. Small things like that weren't making sense to my brain.
Mhm.
Now at least I can prepare myself and pace myself and try and practice beforehand and look into how to do something before I have to do it. Like this live, I had to really kind of plan it from 3 days ago so that I knew what I was doing on the laptop and write steps for myself. And it's the small things like that because it does change the way your brain works.
Mhm.
Yeah. But
Yeah.
have you got any before? Because I think I don't want to keep you any longer. And I think we have about 4 minutes left. But I was just thinking, do you have any closing remarks that you kind of wanna send out there to parents or, how they can, I mean, you've told them how to advocate for themselves, and I think that's definitely 100% what I agree to as well. Um, and then if people want to ask questions in the Facebook group, they can do, and we can answer via the text or chat, function as well in the group.
Um, just one thing, if you have kids,
Mhm,
um, or a family member, and they tell you something's not right, something's
mhm,
wrong, actively listen.
yeah,
That's one thing I can tell you
mhm,
because my mother, there was a point in time where she didn't listen, and without revealing too much, I almost died.
mhm,
So now, when she sees me and she suspects something's wrong if I don't talk about it, because I don't always talk about my pain, because like you said, I don't feel like singing the same tune all the time. Uh, if it's bad enough, she'll notice and she'll say,
mhm,
all right, do you want to go to the ER?
mhm,
What to do?
mhm.
She listens more now. So
Yeah.
especially if you have kids, because when I was a kid, she didn't always listen to that. She just
Mhm.
growing pains, and she's listening
Yeah.
to the doctors because the
Yep.
doctor's supposed to know.
Yeah. Yeah.
But just listen, because you never know what you're gonna hear, and that can mean the difference between life and death,
Yes.
being paralyzed,
Mhm.
having a full-blown stroke,
Mhm.
um, or full-blown pain crisis, that could mean the difference between those things.
Yeah.
And afterwards, just kind of be there.
Mhm.
It sounds simple, and you might hear it before, like if someone passes, I'm here for you.
Mhm.
But the daily life is the hardest part,
Yeah.
I think. So just kind of be there for that, for the kids, for the family member, for whoever
Mhm.
um, and make sure that they see a hematologist, get
Mhm.
checked, and make sure that they understand that if I'm having issues and I have sickle cell trait or beta thalassemia,
Mhm.
um, I am not asymptomatic.
Mhm.
Stress that. And if they don't believe you, go somewhere else. You have the right
Yeah.
to do that for yourself or for your family member or whoever.
Mhm.
So those are the most important things. Make sure that you're listening, make
Mhm.
sure that you're understanding that this person is going through something, and make
Mhm.
sure that they understand that they have rights when it comes to their medical health, their health and
Mhm.
safety.
Definitely. Definitely. I 100% agree. Um, on that note, I all I can add is listen, just stress again, listen to your children. Listen to your body if it's you going through it, because you never know what you're listening to your body. I mean, I wish I had pushed even more with the nurses and said, well, I want a second opinion. Can you refer me anyway? I need referring for stroke, because maybe that would have prevented, everything if they'd have caught it on time, because I'm still query diagnosis, Bell's palsy, query stroke. And that was the diagnosis. So they queried both, but I don't have a diagnosis, or they didn't give me a diagnosis. And I don't expect them to. Um, the stroke nurse came to me and she said, your symptoms, we think it's Bell's palsy, but actually your symptoms, especially with the paralysis on the opposite side, is a stroke. So that was enough for me. And I knew what I was going through beforehand. And I was like, well, I can't move my right leg. I can't move my right arm. They did the tests and my muscles weren't working. They didn't, they didn't even do much in the way of testing, just like did a muscle function test and the one side wasn't working properly. They said there's weakness in that side. And then they sent me home after nine days of admission in neurology. But again, our bodies present different when it comes to having traits. You know, our
Mhm.
bodies present different to having full blown, um, you know, hemoglobin SS, sickle cell anemia, or um, it's just, yeah, our bodies are just different. So I'm okay with that. And now it's just management. I I noticed that the more I smoothie make as well, that helps my body. So I just wanted to shout out to the British Heart Foundation for recommendations on diet to help with strokes, recovery, and look into foods that help, leafy green vegetables full of folates. We need extra folic acid anyway,
Mhm.
to
I'm
help
actually taking that.
hemoglobin. Yeah, same here. I'm taking a whole range of like high strength vitamin D, and then having the supplements with vitamin K inside to help absorb the vitamin. Is it vitamin D and K? Yeah, I think so. But yeah, so fresh greens, fresh fruits, organic if you can. If you can't, I think just as long as you're having fresh everything, and fresh greens, have a lot of greens in your diet. Parents whose kids don't like greens, find a way to kind of mash it up, make it nice for them, make smoothies. There's loads of smoothie recipes out there, and
Mhm.
make them eat it, make them drink it, because you never know, it could just help prevent, nourish the body, nourish the nervous system. And that's what we need. That's what we need. And prevention's always better than cure if you're able to prevent a stroke, or, so definitely listen. Um, and on that, I will say thank you to our listeners. And Chauncey, thank you so much for joining me. I know that it's been a long night for you.
Yeah.
And I hope you can get some rest. And I hope your niece allows you that chill out time.
Hopefully, I can take off my mom's hands in a minute. But if anyone out there, like Mape said, throw some questions in the on Facebook, or if you're not comfortable, you can DM me. I'm always up because I have insomnia, but I'm always happy to answer any questions or just kind of wax poetic about different experiences. So
Mhm.
I'm here, I'm around.
Amazing. Thank you so, so much. And thank you to Luimba for joining us as well in Zoom as well. Thank you so much. And thank you to everyone else who's joined in Facebook. I'm just having a quick look. I'll just tell you we have a
So
lady who's
there's a
joined.
couple.
Can you see the comment? I can't see it. I'm on my laptop, so I'm trying to kind of see. Um,
But they said you're amazing in the Zoom chat.
Thank you so much, Wimba. Likewise, so are you. And then Duchess Lacaducious. This is a great discussion. Many people think that only full-blown sickle cell patients like me experience different kinds of complications, including strokes. I've learned a lot from this discussion. Thumbs up to you guys. Thank you so much.
You're
Uh,
welcome. Thank you.
Definitely. Thank you. Thank you for listening in. And yeah, I will say bye for now until next time. And maybe we'll have to come back and do, another catch up after, surviving, but life now. Maybe in another
Hmm.
months or so, we could do another one. I think
Yeah,
that would be really good to catch up and see where we're at in our recovery stages.
yeah, definitely. You get some rest too.
I will. I'm definitely in need. So yeah. You too, and have an amazing rest of your day. Oh, thank you, Lumba. She said, yes, please. We need more. I learn a lot. Thank you.
Yeah,
So are we. We're learning together. Blessings to everyone and lots of love from UK and from Florida.
yeah.
Yeah, blessings all. Bye.
Right.
Bye, Chauncey. Thank you, sis.
Sure.